My practice is actually comprised of about 30% revision surgery. This either means that it is a secondary facelift for patients who have had surgery done really well 10 years prior and are looking for a second surgery, or in patients who have not had the results that they were hoping for more recently from another surgeon. And I would say that more often than not, why patients are disappointed is because either the surgery has not been executed as well as they were hoping for, or that the expectations set may not have been realistic. And so most of what I do during consultation is set an expectation of what surgery can and cannot do. I love to take a look at older photos of patients to determine whether or not they want to be restored back to a certain period of their youth, or if they're looking to look like somebody different. My practice and approach has always been focused on restoring natural beauty, and we stray away from creating unnatural results. When we talk about revision surgeries, I do find that surgeons sometimes miss the mark in not talking about all of the dimensions of aging. And while surgery can restore the muscle descent that we typically see, many people will ignore the two other major categories that can be done during surgery or achieved during surgery that will also restore a face back to its youth. And when we talk about the aging face, there are three major Ds. Descent of muscle, which can be restored with facelift surgery, deterioration of the skin that can be helped with laser, chemical peels, or skincare, as well as deflation of the fat compartments. And so when we talk about deflation of fat compartments of the face, we're really focusing on the deep compartments that are underneath the SMAS layer. And frequently during my facelift surgery, I will do fat grafting, which is a transfer of fat from the lower part of the body, either the abdomen, outer thigh, or inner thigh. It's processed into the more stem cell rich component, and then we inject it into the face. Not as if we're restoring or creating a new foundation to a house, but it's mostly a caulking or a spray painting of the face in order to present smoother transitions and to make folds a little bit less deep. So when I approach a face from an aging face perspective, I'm really focusing not just on descent of the muscle that can lead to folds like the nasolabial folds, jowls, and platysmal banding, but I'm talking about deterioration of the skin, focusing on sunspots, browns, reds, minor creases that we see that cannot be helped with surgery, as well as deflation of fat pockets that we can really restore beautifully with a conservative and judicious amount of fat grafting.